We're live on YouTube and UGTV.
Good evening. Before we begin, I want to address the public that may be on site. If you're interested in addressing the commission on the public hearing agenda regarding the Community Development 2021 Annual Action Plan, you must sign up to speak. If you have not yet signed up on your way in and wish to address the commission on the public hearing, please go to the front table and sign up. When the item is up for discussion, the clerk will call the names in order according to the sign-up sheets. When you come to the podium, please state your name and city of residency for the record. You will be given up to 3 minutes on the Community Development Block Grant issue to state your comments. The clerk will announce when you have 1 minute remaining to allow you time to conclude your comments. If you are here to speak in regards to the proposed public health order, again, you will need to sign up as you come in. We are anticipating a lot of people, so we're limiting remarks to 1 minute. So please have your remarks prepared so that we can accommodate everyone who would like to speak. We do have 2 potentially very lengthy items this evening to address. Before I call the meeting to order, I want to announce that due to COVID-19, some commissioner staff and public are attending remotely via Zoom, by phone, or on site. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak so the public that is observing knows who is speaking. This is critical given the number of remote participants and is current guidance from the Kansas Attorney General. Due to COVID-19 requirements, the public is allowed to participate by Zoom or submit comments by email prior to the meeting. Those comments are included in the record of the meeting. And the public does also have an opportunity to provide brief comments from the lobby of the municipal office building. So I'll call the meeting to order. Ask the clerk to read the call. Read the roll, please.
Good evening. You are hereby notified that I have called a special commission meeting of the Unified Government of Wyandotte County in Kansas City, Kansas, to be held Thursday, August 5th, 2021 at 7 p.m. in the 5th floor conference room, 701 North 7th Street, Kansas City, Kansas, regarding continuation of a public hearing regarding the Community Development 2021 Annual Action Plan and consider a resolution adopting the local health order. Roll call. McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane.
Here.
Markley.
Here.
Walters.
Here.
Philbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Townsend.
Here.
Alvey.
Here. Okay. Our invocation is being given by Commissioner Harold Johnson of Faith Deliverance Church of God in Christ. Please stand and remain standing for the Pledge of Allegiance.
Let us pray. Eternal God, we come tonight thanking you for this day that you've allowed us to see, a day that was never promised to us. We ask you, Lord, to come into our presence. We invoke your presence tonight to lead us and guide us through the items that have been listed for us tonight, for us to consider and for us to vote on. We ask that you would lead us and guide us according to your tender mercy, we pray. In the name of Jesus Christ, our Lord. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I ask the clerk if there are any revisions to tonight's special meeting.
Thank you, Mayor. Yes, a blue sheet was issued modifying the local health order, adding schools to the list of places where face masks would be required. I should also note that the original agenda order has been modified this evening where the local health order item will be discussed first, followed by the continuation of the public hearing on the Community Development 2021 Annual Action Plan. Those are all the changes.
Thank you. So we have one item under the administrator's agenda. And so just to be clear, that the reason the order was changed was to allow Dr. Steve Stein from the University of Kansas Medical Center to join us this evening. The commission may have noticed that we received an email from the Greater Kansas City Chamber of Commerce, which had requested that we would postpone our public hearing and potential vote until after tomorrow morning, when the chief medical officers in the Kansas City region will do a presentation to the elected officials and agencies across the metro area, describing the current condition of hospitalizations, staffing, and the demand on hospital services throughout the region. Did not think prudent for us to delay any longer. Again, last Thursday, we did not bring this to a vote. It was for our discussion and for consideration over the week, but felt it necessary to bring this item tonight. And so we're going to continue with that. But at the same time, it's necessary for us to hear the data and the evidence from Dr. Stites. And so Dr. Stites has got a very busy schedule. We included him this evening, and he'll be one of the first presenters from the health department. So at this point, I will pass it on to Julianne Van Loo, Director of our Public Health Department. Julianne.
Thank you, Mr. Mayor and Commissioners, for having us back this evening and for picking up this very important and timely topic. I also have with me this evening our Health Officer, Dr. Alan Greiner, our Deputy Health Officer, Dr. Aaron Corvo, and our Chief Epidemiologist, Elizabeth Gronway. But as the Mayor mentioned, we're going to go ahead and kick off with a presentation by Dr. Steve Stein. So Steve, we'll throw it to you.
Thank you. Can you all hear me?
Yes, sir.
All right. So thank you all for allowing me to speak before you this evening, and thank you all for all that you do. To be clear, I am not an elected official, and you all have a hard job to do, and I think have done a great job throughout this pandemic. I'm a doctor, and actually, I think it's even more appropriate to say I'm a Star Trek nerd. And in the words of Dr. McCoy, darn it, team, I'm a doctor, not a physicist or epidemiologist or something. But I am a very concerned chief medical officer. And tomorrow morning at 9 a.m., I will be joining every chief medical officer in Kansas City, representing every hospital system, including not only the University of Kansas, but also HCA, St. Luke's, Liberty, North Kansas City, Lawrence Memorial Hospital, Olathe, Advent, Shining Mission. I'm sure I've left some Truman and others. We have one message that we'll be giving tomorrow. And that message is that the Delta variant is new and different and very bad, and we are overwhelmed and we need your help. We are frightened. We are frightened at the future, and we are frightened by where we are as a collective healthcare community at this time. And we are frightened because today we are struggling to take care of our own patients, both those with and those without COVID. In the next series of slides, I want to walk you through what is scaring us and ask for your support in helping us adopt public health measures throughout our community that have already bent the curve and we know can again bend the curve. So if I can have our next slide. 2 days ago, this number appeared in the Kansas City Star. 1,115 newly positive cases of COVID-19 in our metropolitan area. That was the highest number since January the 9th. What should concern us even more is that on January 9th, we didn't have home testing. You couldn't go to Walgreens or CVS and pick up a test and just take it home and do it. So by any estimate, this number is undervaluing the full number of positive patients. In addition, we know that our own workforce of 12,500 has seen a rapid rise in our population of patients who are out with COVID or are being tested for COVID. And today, I believe that number was over 100, and that is with a vaccination rate of 75%. So we're concerned about that rapid rise, and we're concerned about the next slide too. This next slide represents the 7-day average of new cases in the Kansas City metropolitan area. And there are a couple of points I want to make sure we all look at. Back at the beginning, when we were talking about the newly described SARS-CoV-2 and COVID-19, there was a shutdown, and we reopened society because it wasn't so bad here in the Midwest. We weren't in New York. And then we kind of went up a little bit in the summer and things calmed down. And then it went up a lot late last fall. November 4th of last year, we held a similar conference to the one we're doing tomorrow. At that time, the rolling 7-day average was around 600. When we do our conference tomorrow, it'll be closer to 680 or 690. Restrictions went into place, including masking, and things got much better in this city. But now we're at a point where the Delta variant, which was first described in our area back in April and May, is now 90 to 95% of the types tested. And what we know is that the Delta variant, which started in this particular epicenter started more towards Springfield, has spread rapidly. Let's take a look at the next slide. We know that one of the problems with this, and this is a slide that was presented to the CDC last week, and which led to the CDC's decision to suggest that all people wear masks inside, whether they are vaccinated or unvaccinated. A couple of things to think about on this slide. First of all, it's the R0 value. Remember, an R0 value is how many people, if I have COVID-19 with the Delta variant, I am likely to give to others in my routine daily living. That's true. And we have the seasonal flu up here. We have the flu pandemic. We have SARS, Ebola, bird flu. Again, this is a slide from the CDC's presentation. And the number of people that each person would give or could infect with others for the original version of the coronavirus was postulated to be between 2 and 4. In Provincetown, Massachusetts, the tip of Cape Cod, in June, they had 2 cases of COVID-19. In July, they had 1,000. And the difference, they think, was around July the 4th, when, because of celebrations and a rainstorm, people celebrated inside. And that was when the Delta variant came to Cape Town, or came to Provincetown, and there was rapid spread. And based on the data from that work, it is postulated that 5 to 10 people or 5 to 9 people can be infected by each individual with COVID-19 who have the Delta variant. That's just as contagious as chickenpox. So for those of us who are pulmonary critical care guys like myself, I've grown up around cystic fibrosis and taking care of patients with infectious disease all my life. We have never encountered a respiratory disease that was as contagious as chickenpox and is as deadly, which is what the left axis says, the fatality rate, as the Delta variant. We are in much more trouble now than we were then, being late last fall. Next slide. This is a slide from the New York Times. It's based on data from Johns Hopkins and others that looks at the risk for the unvaccinated. And what you don't want to be is a deep purple, which we're sort of surrounded by. And if you follow this slide in the New York Times or this map, what you would see is that it's been, which was a small cluster in South Central Missouri around Springfield, largely due to a large number of unvaccinated, and the arrival of the Delta variant has spread up into eastern Kansas, throughout Missouri, northern Arkansas, northeastern Oklahoma, and right up to our doorstep. And yes, here in Kansas City, and yes, in Wyandotte County. These are the individuals who are at the highest risk of developing COVID-19. The next slide also tells us something important, and that's the new hospitalizations. When we started our push about how overwhelmed health systems were late last fall, we did it at a time when the rolling 7-day average is lower than it is today. There has been a 33% change and increase just since last week. And you can see it's getting up to the same realm as it was when we were so concerned, and health systems were saying we're overwhelmed. And that's what we're here to tell you today. Next slide. Here's an example of that being overwhelmed. Not only are we at our capacity, and some hospitals are not, they staff as best they can, but they don't have enough staff. Okay, we staff every bed, and then we staff our alternate care areas. So we have patients staying in the dialysis unit or the endoscopy unit overnight, waiting on a hospital bed. This morning, we had staffed all those areas, and we had 25 patients in the emergency room waiting on a hospital bed with no bed to give them. We've had a record number of phone calls for transfers into KU in the month of July. And we had our highest number of denials. We denied almost 500 people to come to us. That pains us so much because we know those are people who need us, but we can't take care of them. And this is both COVID and non-COVID. And the real loss here is that when we are overwhelmed as a healthcare system, and all hospitals are feeling the same way, folks. This isn't just KU. If you're on the call tomorrow, you'll hear every chief medical officer is going to give you the same message. We need your help. We cannot take care of time-sensitive diagnoses. You have a heart attack or stroke, you may have to wait in the hallway while we try to find you a bed. It may take us 10 or 15 minutes. You don't want to wait 10 or 15 minutes while you're having a heart attack or stroke, because we need to get to you. We're in trouble because we have such a high number of COVID positive patients. Last fall, when we rang the alarm bell, we had about 260 patients that had COVID positive in the what we call the core 6 hospitals. The core 6 hospitals are the ones that have been on our chief medical officer call the entire time. And that includes Liberty, North Kansas City, Truman, KU, St. Luke's, Advent, and Olathe. Yesterday, we had 367 patients. We had far more than we had before. And we've waited and waited, thinking that vaccination was going to be the way that prevented this. But the reality is that we have a population that's 50% unvaccinated, and we have a Delta variant that can infect 6 to 8 people with each person. And we have to do something to try and help us to stop from being overwhelmed, because our caseload is approaching as high as it was at this time, or at last November. I call this, you've heard of Christmas on October. Well, this is November and August. So go to the next slide, please. How do you help that? So the CDC and others have put data out there that says, look, even with the Delta variant, masking changes the outcome. Well, we bent the curve before. We know how to bend the curve again. We need to get everybody vaccinated. One of the questions that people ask is, well, why is vaccine not preventing disease transmission? Because the Delta variant is a little different. And what we know is that individuals who infected with the Delta variant and have been vaccinated have almost as much virus in their airway as those who have not been vaccinated. Now, the reality is that the effectiveness of the vaccine probably is still there. It's just not 95% as far as infecting someone else or getting infected yourself if you're vaccinated. What the vaccinations do help us with is death and ICU and severe hospitalizations. So about 10% of the patients at KU today are vaccinated, but that means 90% are unvaccinated. So if we have a metropolitan area of 2.4 million, we have 1.2 million people who have not been vaccinated. They are really high risk for COVID-19. And even if you've been vaccinated, you could be hospitalized, and 10% of our patients are. We've had 4 vaccinated deaths at KU. Now, each of those people are so darn ill I'm not surprised that they died, but it's to say that we all have to be concerned about the Delta variant and we have to take care of each other. And we know what will work because we've seen it work before. And we also know from other data that masking even helps with the Delta variant. Next slide. And this goes us back to that Swiss cheese model. You know, everything we do helps us prevent disease. And my plea with all of you today is to say that we are at a different time in this pandemic, and nobody's happy about that. And we're trying to talk to our staff and keep their heads up. You want to talk about a group of people who are tired of the pandemic? Come meet our frontline nursing staff who are taking care of the COVID patients every day. They're exhausted. And here we're back at the same place we were last fall. But we can beat that and we can bend that curve and we can keep our city safe and we can continue to take care of heart attacks and strokes and cancer. And we continue to try and bring patients in from other places who need our critical care abilities and our quaternary and tertiary care abilities throughout our city. But we can't do that unless we take care of each other. And we know how to do that. Get vaccinated. That'll reduce our hospitalizations. But the thing that will bend the curve most immediately is the mask. Next slide. So I am happy to answer any questions. The picture I want to paint to you is not one of sheer desperation. It's one of terrific, significant concern. And to get your help to get our population masked so that we can make sure we have the capacity in your hospitals, which currently are out of beds, to take care of people, whether they have COVID-19 or any other diagnosis, and especially if they have a time-sensitive diagnosis that shouldn't be waiting. We're trying to prevent patients from coming in as best we can. We're on the precipice of canceling elective surgeries again, but here's a struggle, at least at KU. We took all those elective surgeries and we put them in our same-day surgery center. So when we say elective surgeries today, we'll be canceling patients who have a lung cancer and they're going to have to wait longer. We have patients who need a heart bypass surgery. We're going to have to make them wait longer. So the people we're making wait longer are not the simple cases. We've got those at a surgical center down the street or out in Indian Creek. The ones we have are the people who need surgeries soon. They really shouldn't be waiting. But we're out of beds. Our staff are tired. Our city's sick. Our community's sick. And we need your help. I'm happy to answer any questions.
Thank you, Dr. Stites. Any questions from the commission? Commissioner Walters?
Yes. Could you look into your crystal ball a little bit for us and tell us if everybody masked and we would slow the spread of the infection, would at the end of the day the same number of people ultimately get infected, or do you think, but it would just be spread out over further timeline, or do you think it will actually reduce the number of infections?
I'm going to say the answer to that question is yes, but the pivot point will be vaccination. So I think that masking both reduces and spreads out infection. It's a great question, by the way. Masking can also reduce infections if people will go ahead and get vaccinated, because it gives you the time to protect yourself and get vaccinated. And if we can get more people vaccinated, and we're seeing, we are seeing a slight uptick in vaccinations. So I like that. We believe that the FDA will be approving the Pfizer vaccine. The reports that are being leaked coming out of the FDA is a September 1 date, and Moderna sometime thereafter. I think once you've got an approved vaccine, I think it will help. And in my patients, and I was speaking to a person today, one of my patients, she said, I think I'm really scared. I think it's time to get vaccinated. And I said, hallelujah, let's do that. So she got vaccinated today. I think that people are beginning to shift a little on the public perception of vaccination. That's my impression. And I would say that masking blunts the curve, prevents your hospitals from being overwhelmed, which helps us take care of everyone, not just the COVID patients. But then it allows us to have more time to find more effective therapies and convince more people to become vaccinated. And then you won't be hospitalized. And even if you get sick, the vaccination is still 95 to 99% protective against severe hospitalization and death, even with the Delta variant. So I think the evidence is that we will do both of those things. We'll flatten the curve and we'll prevent the curve.
Dr. Stites, could you speak to, and I know that this will be part of the presentation tomorrow from Children's Mercy, the trend of the Delta variant through the young population, our young people who cannot get vaccinated yet?
You bet I can, and thank you for asking that question, Mayor. Actually, I had some notes about that, and I didn't get to it. So here's what Children's is going to tell us. Last week, they've got two things they're battling. They're battling RSV, actually three, and parainfluenza and COVID-19. This is distinctly different. The average age for all of us has dropped. Now, part of that's because nursing home patients have been vaccinated. So we're not getting nursing home patients in. So again, the vaccination prevents severe illness and death. But they are having a lot more COVID-19 patients with the Delta variant. So last week, they had 259 people test positive for our children test positive for RSV. And they had 269 patients who tested positive for COVID-19. That's both inpatient and outpatient. They have 12 patients in the hospital with COVID-19, and that includes children in the pediatric intensive care unit and the neonatal intensive care unit. Some of those have underlying medical conditions, but they will show tomorrow that they also have previously healthy children going to the ICU with COVID-19 with the Delta variant. So it's worse. Right? It is worse. And it comes at a time when RSV is also at an outbreak in our community 3 months early, as is parainfluenza. And just to add to that, pardon me, we haven't even seen the influenza season this year. So I think that influenza was hardly on the radar last year. And I think that was largely due to the health precautions and to masking. And I think this year, if we're not masked going into this season with RSV, parainfluenza, and COVID-19, then we'll really be in trouble. And influenza season is about 6 weeks away.
Thank you. Any other questions from the commission? Commissioner Burrows?
Thank you. And Dr. Stites, we appreciate you sharing that information. I think it's very important that we hear from our medical community. The question I have is not only in reference to the masks, the social distancing wasn't mentioned in your testimony, but as many of us are aware in our community, we are seeing major events scheduled that will have hundreds, possibly thousands of people in attendance. Even though some of them will be outdoors, they won't be maintaining the 6 foot distance that is being suggested by some. How do we address those issues? Are we looking at possibly, again, going into eliminating any crowds over a certain amount and starting to look at possibly shuttering businesses that over occupancy or at occupancy that can't provide those safety barriers?
Well, that's a great question. And, I feel fortunate that you guys have Dr. Alan Greiner, Dr. Aaron Corvo to help with that too, and Julie. Here's what I would say. I sure hope not. And, I'm a big Chiefs fan. I miss Arrowhead Stadium like there's no tomorrow. I love watching number 15 out there. And so I want to go back to the Chiefs games this year, and I want to get, and I have tickets to get to my first Royals game next week. I think the combination of masking and vaccination offers us hope we don't have to do shutdown. But if we wait too long to do masking, and we have people with critical diagnosis in the emergency room in the hallway right now. If we don't get our community masked, things will get worse, and then I'm afraid we'll be forced to take other measures. What I'm hoping for is that with masking and vaccination, we can avoid the next step. I don't know if we can, but I know if we don't mask, I can promise you we won't be able to avoid that step, at least from a chief medical officer perspective, to try and take care of patients. And so I am hopeful that in that Swiss cheese model, because vaccination works so darn well, that if we get people masked and people are, they respond to the FDA and they say, that's a good thing, that drug's approved, and we continue to work with communities to get people vaccinated, that, and I think, we're going to see more and more vaccine requirements out there from different groups. And I'm just hoping that vaccination and mask will avoid the shutdown we had to do in the past. But I don't know. My crystal ball, my crystal ball is really foggy and cracked, as my wife will tell you, and as some of my ICU friends will tell you when I try to predict where we're at on palliative care measures. So I think I'm probably not the most qualified person in the world, even in the room, to make that prediction or on this Zoom call. But I'm hoping that with masking and vaccination, we can avoid it.
Thank you, Dr. Stites, for that answer. I guess the question I would have is, as contagious as this Delta variant is projected to be and is, my concern, and I think concern of many, is that masks alone may not be enough. And so I go back to my original question. If we're going to mandate masks within closed facilities, even among those that have been vaccinated, why is being outside and not social distanced any different?
Yeah, again, I think it's a great question. I don't have a good answer. Here's what I just come back to, and I'll try to approach it perhaps differently. I think being outside and being distanced is always better. From a chief medical officer standpoint, is that the perfect answer? You bet it is. But I don't have your job, and so you guys are weighing other factors and businesses and economics and jobs, and we got to keep people alive in a lot of ways. And so I actually do believe that masking and coupled with vaccination, if we get people masked right away, I think if we can get folks masked, I think there is a reasonable chance that masking, even as transmissible as a Delta virus is, will really help us. So if you remember, and hopefully you guys don't get bothered having to watch that morning medical update we've been doing, and we're going to redo the video so we get a little more modern. But if you remember that, if some of you watched that, we did that freezer video last year where Dana Hawkinson, I call him Doc Hawk, Hawkeye, and I went into the freezer. And there's that breath cloud you have, right? And that breath cloud without a mask, it goes friggin' everywhere. But you put a mask on, and just a cloth mask or a surgical mask, but surgical masks are really better. The ones that you can buy in the drugs, those are better than cloth masks, especially with the COVID or with the Delta variant, I think. But you put one of those masks on and your breath cloud is just shut down. So I'm encouraged that will help us. Now, is that good enough for a crowded bar with people drinking and having their masks half on and half off? Yeah, I don't know. That's going to be tough. But I think we're going to know really fast. So in a perfect world, would I say we should socially distance and not have crowded indoor rooms? I'm a CMO. Of course, I'm going to say that's the perfect world. But I don't have the same perspective that you all have. And what I know is that at least in Scotland and some other areas, and even in Provincetown, there is some signal in there that masking plus vaccination will keep us safe. And I that's what I'm going to push right now. I don't think it's the perfect answer, but the perfect answer. Oh wait, I don't think there is a perfect answer right now, and I think that's why we're struggling so darn much.
Dr. Stites, if you when this began, I think last year, March, April, when the shutdown occurred, it was again the threat of overwhelming the health system and the care that could be provided, not just to people who might contract COVID, but everyone else. So that's back where we are again. Moving forward, it would seem to me that what is going to be the regulating factor on any kind of mitigation measures is going to continue to be whether our health providers can maintain services at the level we need and expect for the health of everyone. So the notion or the thought, you're not asking us to be able to eradicate the virus, because that doesn't really seem to be on the horizon for anyone. That's because of the nature of the virus, the way it mutates, that as long as there are pockets anywhere in the world where there is unvaccinated people or a mutation that resists vaccination, there are going to continue to be mutations, which will continue to be a threat. And so if no one here is proposing that we're going to be trying to eradicate the virus, but what's going to regulate and bring additional mitigation measures is going to be whether we have capacity in our health system. Would that be an accurate description?
Well, I think it is. And can I answer your question, the last question? Julie, can you go back to slide 8? I was sitting here looking and I thought I should have thought of this before. There's one before that. It's on my presentation. Go to that slide. Yeah, now the masking slide. Okay, look at that slide. So I'm going to come to yours, Mayor, but I want to get back to that point about masking versus distancing. This is masking. And this is projected by public health experts from the CDC and other groups. You can see where we are here in late July, August, and August 21. If we were to get masks on, look at how fast we think the curve will drop. That's going to protect us. That'll protect our public health system. We think masking and vaccination will have that effect. So now, I think we can get through this like that. Now, to your point, we are, Mayor, look, at KU, we've decided we're going to have one COVID unit and one ICU full of COVID patients, and we see that as the foreseeable future. And some days, last March, in fairness, we got down to 2 patients, folks. We had 2 patients with COVID in our hospital. Today we have 30 times that number. And the difference is, and by the way, we have one of the lower COVID censuses in Kansas City, which is odd, but it's mostly because we haven't been able to keep our transfer center open to business. I think that we aren't masking or distancing will not cure COVID. Vaccination offers us the best way out of this crisis. And I think we should all feel very fortunate that the vaccines, especially the mRNA vaccines, can pivot so rapidly and can be reconfigured so rapidly that we can probably handle just about any variant. But in the meantime, the bigger struggle is we got to get those vaccines into arms, because right now they're expiring on our shelves, and that is just, that's terrible. So I think that it is here to stay. I think to me, as a chief medical officer, we will be prepared to manage a number of COVID patients throughout in the future, and we've planned for that. What we can't do and what we struggle with is when our COVID patients numbers get really high at the same time as our overall census is really high, because people still are sick with stuff that's not called COVID. It's hard to believe that because that's all you read about. But the truth is there's a lot of the disease out there, and we have to try and take care of our entire community. And the way we do that is by offering them a hospital bed and offering them what we think is some of the best care in the world. But everything deteriorates when you got patients sitting on gurneys and hallways, which is where we are today.
Thank you. Commissioner Johnson.
Thank you, Mayor. And Dr. Stites, again, thank you for all that you do. Dr. Greiner, Dr. Corvo, you all are, in many regards, in my eyes, I see you as heroes, just like I look at our fire and our police. You all run to destruction. You all run to disease. And for that, I want to tell you, thank you. As a survivor of COVID, not having blessed not to have suffered enough to have gone to the hospital, I do know how serious this is. The concern that I have is that it seems to me that we are continuing to deal with so many layers, one of which is, it seems to me that there continues to be different variants that kind of become evident to us. And it seems to be a never-ending cycle. And so when we consider mask orders for a certain period of time, that does not put us out of harm's way. Is there any way that you can look into your crystal ball and be able to say that if we are to reach our goals in terms of masking, in terms of vaccinations, more importantly, when will the madness end? If that's a question that I might ask.
That's a great question. I first of all, let me say that I think with Julianne and with Dr. Corvo and Dr. Greiner, you guys are blessed in Wyandotte County. I've worked with a lot of public health officials around this state and in Missouri, and I think you guys have two of the best. So hats off to them, and they are probably much better equipped to answer that question than I am. I don't know when the madness is going to end, and that may drive me mad because I think you're right. The variant is the more variants arise, more mutations arise, the more it reproduces in our airways. And the way it reproduces in our airways is we keep getting sick with it. The way we keep getting sick with it is we don't get vaccinated or we don't wear a mask. So it becomes a self-fulfilling prophecy. Interrupt that chain, the variants begin to drive down. And what we have to do is drive that R naught back down below 1 and keep it there long enough that the virus essentially goes away. And that's how infection, that's how pandemics end. It has to, infected so many people or killed so many people or done so much disease and destruction that it doesn't have any hosts to turn to. Vaccination tries to take away the number of hosts. And one of the struggles we know is that having had COVID-19 originally may not protect you against the Delta variant because it's pretty different, but vaccination works. So if we can keep people vaccinated and we can keep them safe, we think we can end the pandemic. But unfortunately, getting 50% of the population vaccinated, or 35%, or as in southern Missouri, 10 or 13%, that's like you just don't have anybody vaccinated. And so we really, the way out of this pandemic is vaccination and the public health measures that we know work. It's, if you've watched our MMU in the morning, it's what we say, those measures of infection control, they follow you wherever you go and they keep you safe. And that's how we end a pandemic. We end the pandemic with great public health and vaccination.
So there is no quick fix to this.
No, sir, there is not a quick fix.
I understand, and it drives us all mad.
It does.
It really does. But we're going to have a shift in our mindsets as a public. That we are there. There's no 30-day. There's no 45-day. There's no 60-day. Remedy to this. We're going to have to ride this out for the long haul, and to the extent that it infringes upon certain of our privileges and rights and whatnot. I think the right to live, the right to live a quality life, health-wise, seems to me to be something that should help to motivate us one way or the other. So thank you.
Thank you, sir.
Thank you, Dr. Stites. We now turn it back to Julianne Van Loo.
Yes, indeed. Thank you so much, Dr. Stites, for that presentation. I think that's very helpful for folks. We're not going to spend a tremendous amount of time rehashing what Dr. Stites walked us through, but we wanted to just provide a few local numbers here and a little bit of a reminder from our legal team and Dr. Greiner before we turn it all back to you, Commission, to have a conversation. So a little bit more locally, Dr. Stites mentioned kind of the metro numbers. Again, in Wyandotte County, we're seeing the exact same thing. So our numbers of average cases per day are up to 77. That's up from about 10 cases a day 6 or 8 weeks ago. And that's up where we were last January, unfortunately. In the last week alone, 512 Wyandotte County residents have become sick with COVID-19, and 3 of them have passed away, unfortunately. That's just in the week since we last met to discuss this topic. And again, the reason this spread is happening, or at least part of the reason beyond the fact that Delta is here, is the fact that our vaccination rates remain low. We continue to make slow progress, but only 42% of us have at least 1 dose, and only 35, just short of 36% of us are fully vaccinated against COVID-19. I know there's going to be some questions this evening about what surrounding jurisdictions have done and are doing around mask mandates, so we wanted to make sure that everybody has that information. Kansas City, Missouri last week put an indoor mask mandate in place in public spaces that applies to their schools Jackson County is doing the same thing, effective on Monday. Masks required indoors in public spaces, including within their schools. Just earlier today, the Johnson County Board of Commission met to discuss mask mandates, and what they ended up passing was the requirement for mask wearing in school settings for kindergarten through 6th grade, really targeting that age group of kiddos who do not have the opportunity to become vaccinated because they are younger than age 12. And Leavenworth, Kansas, we do not believe is having a discussion around mask mandates at this time. So that's where most of our local jurisdictions are on this particular subject. I'm going to pass it over to our legal team for one quick reminder on where the power to issue local health orders lies today. James and Patrick, I'm not sure which of you is going to take this slide.
Thanks, Julianne. James Bain, Unified Government Legal Department. This slide kind of reminds us of the big game changer when it came to local health orders. There was a time, you'll remember, where the local health officer could make orders without any approval from the commission. And then it changed last summer after the legislative special session where commissions could amend health orders, and we've done that a couple times. And now, after the passage of Senate Bill 40, Board of Commissioner approval is required under certain categories of orders, and one of those being face masks. The other kind of game changer in SB 40 was during a state of emergency, a statewide declaration of emergency by the governor, the ability to make these orders in schools was left exclusively to schools, only during the time of the declaration of emergency. The Kansas declaration of emergency has ended, and so that power is now back to being concurrent the way it was a year ago, that both school boards can make health orders for themselves and local health officer and county commissions can make those same orders on schools. So it's a concurrent power that both organizations have. And the final big change from Senate Bill 40 was it allowed citizens to challenge the local health orders. Our charge was to make the orders, well, the court's charge will be to make sure the health orders are the most narrow to achieve the health goals. And that's all I have, Julianne.
Thank you, James. I think what we as a health department want to make sure everyone understands is that the fact that the power, again, lies with the Board of Commissioners in concert with the health officer to apply these orders to schools means that we have put that in the order that is in front of you this evening. It would be our recommendation that schools be included in this order, especially because there are so many kiddos who, again, cannot have access to the vaccine by virtue of their age. So just a couple of slides left here for us. Dr. Greiner's gonna.
I have a question right here.
Yeah, Commissioner Kane.
Yeah, I called, go back to that slide, please. I called the state yesterday and they said we can carve out the schools if we choose to do that. And they have an elected body to do that. You know, the schools in play would be like Bishop Ward High School, Donnelly College, the Kansas Community College, and the Piper School District. They have elected boards to do exactly what we're going to do here a little later. And my request is that we carve them out and let them make their own decisions and put it on them because they have to respond to the community like we have to respond to the community. You know, it just, and I didn't realize we could do that till I called up there yesterday. So I don't know if I would need to make a motion for that, Mayor, or how would that work?
Right. So I think what the health order that's been proposed does include schools. So it would have to be, I think, a motion that you would do that. But I don't think we're at that point
Okay.
yet.
All right.
Because we are going to take public comments.
Dr. Greiner, I'll hand it to you for the last two slides.
Great, thanks, Julianne, and And thank you, Mayor. Thank you, Commissioners. Thanks so much, Dr. Stites, as well for your great presentation. That was super helpful. Just a couple more things. You know, as we've looked at this and tried to bring forward our recommendations for what we feel like the commission ought to do, we're looking closely at things like, are we an area of high transmission? This is a CDC map that clearly shows our region, much like the slide Dr. Stites showed earlier. We're an extremely high area of transmission. We have over 100 new cases every 7 days per 100,000 individuals in our area. That's what red means. If you're blue, you have much less than 10 per 100,000 people. It also means you have a percent positivity rate that's very high, and ours is above 30% in terms of total numbers of tests and the percent that are positive. So we've got a major concern in that high spread. We've of course got Delta variant, and we know it's much more transmissible, and it's almost 100% of what we're seeing. We know that the majority of our residents are not vaccinated, and we're about to start school, and we want to keep kids in schools. We know that's important. We've already seen the damage it can do to not have kids in schools, but we think things like masking can have a major impact on that. And we've heard so much about hospitals already. Next slide, Julian. So our recommendation, basically exactly the same recommendation we had last week. We feel like mask wearing in indoor spaces is extremely important at this time, that it should be for both vaccinated and unvaccinated individuals. This doesn't mean we're not going to continue to push vaccinations. Of course we will. We feel like it should be for everyone 5 and older, like we had in previous orders, and that we should go with a 6-week time period given what we're seeing. And again, if you think about that curve Dr. Stites presented, where we've seen how quickly it's expected that we can move forward with a mask order in place. We think 6 weeks is right for now. This and it aligns with the CDC guidance. It aligns with what Kansas City, Missouri, and Jackson County have done as well. So that's really all we have, and we'll in there and happy to take questions as well, and hear the discussion and comments. Thank you so much.
All right. Are there any questions or comments from the commission before we take public comment? Commissioner Bynum?
Thank you, Mayor. I just want to agree with Commissioner Kane on carving out specifically the school districts and the community college, which has already made their announcement about mask wearing. They are served by elected boards who have responsibility for making the best possible decisions they can for their communities. And I want to echo Commissioner Kane's desire to carve out the school districts away from any health order on masking that we might take up tonight. It's my understanding that all of these leaders in these institutions have direct contact with our health department and the leadership and the medical experts, and understand the issue that we are facing, and they should be allowed to have the responsibility to make the decisions for their constituency that they serve. Thank you.
Commissioner Ramirez?
Thank you, Mr. Mayor. I'll try to be as brief as I can. I have a friend in Johnson County. I asked if they could give data on their vaccinations. And now this is 2 weeks old, but a percentage of their total population, 67.8% have 1 dose. 58.1% are fully vaccinated. Johnson County is taking care of Johnson County. They're doing what they need to do. And Johnson County, the residents of Johnson County understand what it takes. And I hope that Wyandotte County, we do the same here. That we continue to do what's right. As I said the last time we had this conversation, we have 2 choices. Do what's right and protect our community, or allow the politics, the politicization of this topic to dictate our policy choices as a governing body. Those are the two choices we have. I did a survey of my district. I put it on Facebook. Only about 60 people responded. I didn't have enough time to go district wide and actually go and knock on doors and get an actual credible amount. But out of the 60 some that responded, 92% of the people support having a mask mandate. Again, I had a small business social in my district. Every single small business owner told me they supported it because it would help them. It wouldn't hinder their business. Our inaction would hinder their business. I have a nephew who just beat cancer. He's immunocompromised. He goes to school. His mother, my sister, is scared because he is at risk. And I understand that these school boards have their own authority, but I'm fighting for my family. That's what I'm fighting for, my family, for my constituents. And the majority of who say and have told me they support it. We have a minority that we are hearing that are loud and proud. But let's not forget the silent majority that are not here, who are not sending us emails, who are not voicing their concerns. And I'll end here with one thing that wasn't mentioned, and I mentioned it last time, Julianne. This health order only asks for you to wear a mask. It doesn't restrict business hours, does not restrict business capacity, does not restrict business numbers in any way, shape, or form. It only asks you to wear a mask. Nothing else. Two quotes. The first quote was actually from a person who emailed us today, a person who was for the mandate. And this line caught me. Freedom doesn't include selfishness. The other quote that I want to read, and I don't know who the author is, it's one of my favorite quotes that I try to live by, especially in the position I am. Whenever you know what is right, you must know the courage that it demands. I'm not here trying to score any political points with anybody. I'm here to do what's right and what I was elected to do. And that's to maintain the safety, security, and prosperity for this county and my district. So I ask that you remember that. Remember that what to do is right. It takes courage to do that. And every decision we make is a courageous decision. It's a good decision for our community. Let's not forget who we're here for. Thank you.
Commissioner Burrows.
Thank you, Mayor. I want to get to the fact that if we talk about our bordering community that is only and mandated that their children wear masks in school, that means their businesses will not be required to do so. And so those individuals in our community that choose not to wear masks will take their economic viability to another community, which is, whether they're vaccinated or not, impacts the economy that we are trying to address in our community. I mean, this is all a political, economical, emotional, and psychological issue. And it's very difficult to separate those four issues from the true aspect of the effect of this pandemic. I guess my comment would be that if we're going to allow the school districts to have a voice, there are commissioners sitting here this evening that represent other cities within their districts. And they have an elected body, a mayor and a city council that should have the same opportunity to make those decisions. So I would ask that we give them the same authority that we're asking for with our school districts, and that be Bonner Springs and Edwardsville, that they have the authority to pass or support whatever piece of policy they feel is beneficial for their city. My concern is that when I look at a picture of Johnson County at the festival, I guess they had the other day, there are hundreds of people that aren't social distanced. We don't know that they had vaccines. We don't know if they're part of the 60% that was shared in previous testimony. So we do know that if they come over here, they're going to have to wear a mask. But if our residents that choose not to get a vaccine go over there, we are still going to perpetuate this disease across county line. This disease does not stop at the county line. So I would just ask that if we're going to allow one entity the authority to mandate or to allow not having masks, that those city councils and those mayors have a chance to pass their own piece of policy.
Commissioner Philbrook.
Yes, I believe that all of the elected officials, no matter which burg they're from or which county, have a responsibility to their community. And yes, I'll say it more directly that the decisions that they choose to make will impact on their community. And so, yes, Commissioner Burrows, I understand your comments. And I don't presume to know more than they do. So I do understand that comment. I pray that the other areas, Edwardsville and Bonner, will take into consideration possibly maybe stepping up to the plate and actually to make some of those hard decisions to follow through and care for their communities. I'm not willing to make them do anything. I think that the proof is in the pudding, and if they don't do what's best for the community, it'll come back to bite them, and that which will be sad, a sad thing. I myself have had a lot of patients tell me that they're happy about some of the mandates because they're scared to death for their children when their kiddos are in school. And most of the kids are having to wear masks when they're going back. And in a lot of the private schools, they're having to wear masks because they don't want their kids to get sick. And I would tell you that probably well over 90% of the patients I see have had their shots. And that or they're fibbing to me, one or the other. But the whole point being is that the ones that haven't had their shot, we talk about it. And some of them are willing to go do it and some of them are still scared. But the point I'm trying to make is that what some other folks have said is, yes, we have a loud bunch of folks who have a right to their opinions, just like I can be loud and I have a right to mine. But I'm not going to let opinions overwhelm my education and follow what the medical profession tells me is the right choice. So this is not easy, and actually I think it sucks, but hey, that's just a personal opinion on that. But we're paid the big bucks here to make these decisions, and we're elected to make it. And so I'll be more than happy to step up to the plate when it comes to a mask mandate. And please, please get your inoculations.
Okay, let's go ahead now. I know that we have some folks in the lobby who would like to speak. Who is facilitating that in the lobby?
We actually have two people working tonight. Terry and Monica will be facilitating that, Mayor.
Okay, so just so you know, we're limiting 1 minute to comments, so please have your comments ready to go. We have a lot of people want to speak. We also have another hearing after this one. So let's go ahead and there'll be someone in the lobby who will be limiting you to 1 minute. Please state your name and city of residency.
Hi, my name is Tracy Ramey. I do apologize. I thought we was going to have 2 minutes, but I hope each of you read the email that I sent you earlier today. It does show the facts and figures from the Kansas Department of Health, and those the figures that were given from KU were actually not specified for COVID. If you please review the figures from the Kansas Department of Health in the email I sent you, it will show that COVID cases that are hospitalized are only slightly higher than the average influenza for this time of year for the last 2 years. And it will also show that deaths are throughout the state are very minimal. There's not a spike in deaths actually. So I implore you to take into serious consideration that Kansans are smart and savvy and free citizens. And we implore you to take that in consideration, that people should be allowed to do what's best for themselves and their family, and they will make amazing decisions. After all,
Ma'am, your time has expired.
Mayor, am I on? Can you hear me? Mayor, before my time begins, I have a request for information. Can you hear me?
I can hear you.
Mayor, may I make this point of information, request for information rather, before my time begins? Is that all right, Mr. Mayor? It's about the agenda.
No, if you want to ask a question about the agenda, I guess.
Thank you. So am I correct? The item number 10, the resolution to adopt the local health order has been moved up, and it'll be the very next item following public comment?
Yes.
That's correct. Okay. And also on the agenda is the consent agenda. I have not found a copy of the consent agenda listing the items
This
that
is
are
a
on that.
special
Is that
meeting.
available?
Yeah, I'm sorry. It's a special meeting. There's nothing on the consent agenda tonight. That's just with its standard form. There's no items on the consent agenda.
I see. Okay, thank you. And we were told we have 2 minutes to speak each. Very
1
clearly,
minute.
we were told.
1
So
minute.
that's half of what we were told. So many people here who were preparing for 2 minutes, just so you know. Okay. My name is Ned Kelly. I live in Kansas City, Kansas, and my time begins now. I could have saved us all about 50 minutes of the beginning of this meeting. In summary, we're not scared enough. They want you to be more scared. That's all that everything Dr. Seitz and all the medical experts gave us tonight was to tell us you're not scared enough. We need you to be more afraid. Now, I'm not saying that flippantly. It's true. There's about 10, 15% of the population who are committed believers. You don't need to sell them. They're already totally believing the masks are magical. There's about 10, 15% who nothing you said tonight changed their minds. And then the rest, about 70 so percent of the population are getting tired of this song and dance. Let me ask you one quick question. If you are practicing tyranny, would you know it? If you are abusing us, would you know it?
Sir, your time has expired.
Okay, am I on? Can you guys hear me?
Yes, we can.
All right, my name is Lacey Langford and I live at 6608 Wooden Avenue, Kansas City, Kansas. I was born and raised right here in Wyandotte County. I come to you today so very glad that you guys brought up science actually in other countries, as we have a lawsuit out of Alberta that was lifted because they could not provide any evidence of COVID existing. Okay, so why, tell me why does American science, political paid for science, differ so much from other countries? Why is that, commissioners? I also would like to address the very fact that every single report that has came out since this Delta variant, which I would also like to put on record, there is no test for. I have that through fact checkers that I get banned by on Facebook all the time for telling
Ma'am, your
me
time
it's
has
true.
expired.
Okay. Huh? Right.
All right, may I speak? Hi, my name is Mary Gerlt. I live at 419 North 22nd Street in Kansas City, Kansas. And I come to you tonight because after everything that we heard tonight, I have really good news for you, commissioners. I can let you guys off the hook of this awful decision that I know is weighing on you and that you feel so guilty about, because guess what? This is actually not your role as government, okay? Per the U.S. Constitution, you do not have the authority to legislate behavior upon nonviolent people. So you're totally off the hook for this. Everyone is responsible for themselves. Everyone's responsible for their own personal health. Commissioner Ramirez said that he doesn't want to politicize this, but even by having a mandate of voting on this as elected officials, you are making this political. And Commissioner Philbrook, you said that I have a right to my opinion, but I also have a right to my body and my face and my health. And the health department representative, Julie, said that 3 died last week from COVID. How many more had died from heart attack or diabetes? So why don't we have a ban?
Ma'am,
on
your
sodas
time
and
has expired.
Where is that coming from?
Hello, my name is Alex Sanchez. Thank you, Mr. Burrows, for your voice of reason. Overall death rates in 2019 compared to 2020, absolutely no change. CDC stats, 645,000 people every year die from the common cold. Furthermore, limiting gatherings in religious situations or otherwise is a violation of our constitutional rights. As far as the masks, they are only designed to protect you up to 0.5 microns. These viruses that we're talking about are 0.1 microns. Masks are completely incapable of stopping anything. The vaccine, we know, is experimental mRNA. And we also know that if you look at the statistics in Massachusetts, 74% of the people who've gotten the jab are the ones who are getting the variant, because the jab is designed specifically, and there are studies that show that the Pfizer vaccine specifically has dropped people's natural immune system by 1/6.
Sir, your time has expired.
Thank you.
Okay, I'm going to, excuse me for 1 minute. We're going to suspend this until we get this corrected.
That we were
And
promised?
if you would just hold on, we're going to hold off here because I'm trying to correct something in the process. If you would just hold on, please.
Okay.
Okay, thank you. Now, thank you.
Thank you. Am I free to speak?
Yes, please.
Okay, my name is Stephanie Barton. I live in Turner. A constitutional republic protects the right of the individual. As representatives of a constitutional republic, you must govern within an existing constitution. You cannot deny the lack of representation we the people feel here today, and that's why we're here. We the people have a responsibility to hold you accountable. But let's take science into consideration. Let's say masks are not intended to stop the spread of COVID. The vaccine was supposed to stop the spread of COVID, but yet you tell us we have to continue to mask our children. We demand the right to choose. We should not have to do so. If masks work, if the vaccine works, why are you so determined on denying those who disagree? We have a right to choose, and you are taking away our choice. Again, you are elected officials, but you are also representatives. Listen to us. Listen to what we have to say. We are absolutely capable of making our own choices.
Thank you.
Hi, my name's Darren Duffy. You guys can hear me okay?
Yes.
All right. Well, I was running for mayor. I'm not running for mayor anymore, so I figured I'd take up another fight. Thing is, we don't need you guys telling us how to live. We've never needed it. Your job as elected officials were to represent us and represent our communities, and you are not doing that. The thousands of people that I've spoken with over the past few months, this was second on their highest priority list. 0 masks. They are tired of it. You guys do not have a right to do this. CDC is privately owned. Pharmacies are benefiting them, and it's just a recommendation. It's not a mandate. You guys need to back away from it.
Thank you.
Hi, my name's Lori Kovac. I'm from Wyandotte County. I've lived here almost all my life. I have grandchildren that go to the schools at this time. My youngest grandson has a speech impediment, so these masks are causing problems.
I'm sorry, ma'am. Can you restart? We had a problem.
My name is Lori Kovac.
Thank you.
I'm from Wyandotte County. I've lived here almost all my life. I've never had to go through this. My grandchildren have to go to your schools. My youngest grandson has a speech impediment, so these masks are causing even more problems. The reason that they're not being able to find out the truth about all these percentages and everything else is because of all the censoring that they've done. The government has taken away all the rights for taking the hydroxychloroquine or the ivermectin. So if you guys would give that to these patients that you say that you have in these hospitals, then maybe we could have a survival rate that would keep us from having to take these damn jabs and these masks. So if you guys want to help us, take away these masks and let us get our immune systems back up instead of trying to kill us with these damn things. Thank you.
My name's Josh Monington. I'm a resident of Kansas City, Kansas for a little over 20 years. I appreciated what Dr. Stites said, that he said, I don't have your job. You see, science doesn't make decisions. Representatives make decisions. We choose how we respond to this virus. And though it has daunted and dogged our steps, much of the problems that we have faced have come from government. Government orders have illegalized our most intimate family gatherings at Thanksgiving and Christmas. You've desecrated our sacred institution, marriage and church services, weddings, funerals. Commissioner Ramirez says this order asks. No, it does not ask. It demands, at the cost of $500 fines and 30 days in prison. One needs to ask if masks are so popular, why we need an order.
Hi, my name is Mark Monington. I'm a resident of Wyandotte County. That was my son. I've got 5 other kids at home right now. We've all had COVID, okay? None of us died. I'm 65. We got sick. We went to the doctor. We got taken care of. I know that there's people that are dying. I know that 3 people died last week, but other people died. I'm an American, okay? It was my choice. We chose to go to the doctor when we needed to. We made our own free choice. It's not your responsibility. Saying that you're asking me to wear a mask is like when the policeman says, put your hands on the steering wheel. He's going to get his gun out if I don't. You're going to fine me $500 and put me 30 days in jail if I don't. That's not asking me. That's not your position. That's not your position. I didn't ever vote for you to be in that position. I'm responsible for me. I'm responsible for my family. I've been going to church without masks for this whole time, and we didn't get sick from church, okay?
I'm Lisa Michaels. I'm from Kansas, and I just want to tell you that Satan worshipers, they have to stand 6 feet away with a face mask on. These face masks only serve to protect the anarchists that want to protest, so you can't identify them and you can't arrest them. These things are petri dishes for disease, and they are terrible. And there's never been one. You show me one, and all the stuff that you showed us earlier, you didn't show us one example of a double-blind study showing that these masks protect us from anything. The microns it's 10 times as big. The holes in the mask are 10 times as big as the virus itself. This is ridiculous. This is child abuse, and this is a violation of the Nuremberg rules. You're not allowed to insist that anybody take any sort of medication, and you could be tried for treason, crimes against humanity. Thank you.
Hi, my name is Sandy Duffy. I'm from Kansas City, Kansas, and I'd like to discuss fear with you because fear is super fun. Fear releases a chemical in the brain called cortisol. What cortisol does is it inhibits children from learning. It incapacitates their executive function and does not allow them to learn. So essentially, by pouring this fear on these kids, what you're doing is turning them into mindless zombies. You're making it so they can't learn anything, and you're dumbing down one of the poorest counties in freaking Kansas. I can't even believe that you would have the audacity to do this. And the one thing that will fight the cortisol is oxytocin. Where does that come from? A smile. Hey, any parent watching, they are murdering your children's education and they are harming your future. Thanks, guys.
John Burns, Kansas resident. Can you hear me? Can you hear me? Hello?
Yes, we can.
Thank you. Handcuffs do not loosen. Freedoms do not make comebacks. Our captors will never run out of strains, variants, or pretexts under which to usurp our freedoms, the fruits of our labor, our livelihood, blackmailing us at every turn with do this blind act of obedience and you can have a little bit of your freedom back as the little bit gets more and more little every time. You've seen the boxcar loads of human skulls and wedding rings, and this is how it all got started. It's for your own good. Live free or die.
Is there anyone else in the lobby who is intending to speak?
Hi, my name is Carolyn K. Hart, and I just wanted to take a moment to thank Commissioner Burrows for the consideration of letting local governments make decisions for their constituents, specifically for Edwardsville and Bonner Springs. Thank you, sir, for taking that time, and thank you for letting us speak and for your consideration.
Okay, now close the public hearing.
Mayor, we
I'm
do have
sorry.
hands raised online.
Okay, thank you. I'm sorry. Let's go ahead and go to the first one.
NBCDC.
Thank you, Mayor and Commissioners. This is Broderick Crawford, lifetime resident of Kansas City, Kansas. Thank you, Dr. Stites, Greiner Corvo, and Julianne Van Loo. I am speaking in support of the mask mandate because I want to protect my family. I'm protecting my family because of folks that are unvaccinated that are walking around as if they're vaccinated. We need to stop the spread. The way we stop the spread is to mask and vaccinate. Again, Broderick Crawford in support of a mask mandate. Thank you.
Our next speaker is Andrew McKesson.
Can you hear me?
Yes, sir.
Okay. Yeah, I also just wanted to speak in favor of a mask mandate just to, outweigh or make sure that you guys know that there are some people in support of it. Appreciate that. Thank you. Have a nice night.
Our next speaker is Mamie. Ma'am, your microphone is muted.
Can you hear me now?
Yes, ma'am.
All right. Well, can everybody calm down for a second? I mean, everybody in the public lobby, calm down. We're going to take care of everything what is supposed to be taken care of, but at the same time, calm down. Can y'all do that? Can I hear somebody from the public say, yeah, we can do that? All right, calm down for a minute. Let our commissioners speak. Let them take care of what they need to take care of. Because if we want to keep our families safe, we do have to wear masks. If we want to keep our families safe, we do have to get the shot. Calm down about that.
Ma'am, your time has expired.
Thank you.
Our next speaker is Lucas Tillman.
Hello.
Yes, sir.
Okay. I just want to have a consideration for some small businesses who are still struggling to get back on their feet. And if we can do an ability to, if you can stay socially distanced by 6+ feet, and also if available if people have been vaccinated and proper ventilation that we as business owners can recommend, but it would not be required so that we are able to operate and try to get our feet back underneath this. Thank you.
Our next speaker is Rachel Jefferson.
Hello, thank you for this opportunity to speak. I've heard a lot tonight, a lot of vitriol, a lot of misinformation. So I just wanted to speak up and say that I really appreciate you all considering this mask mandate. As someone who has known people who have died of this virus, it is extremely important that we protect the welfare of each other as we go through trying to recover from this pandemic and from this virus. We all have the right to make personal choices, but this is not one of those times where it's a freedom issue. It's an issue of, do you care about your neighbor and their livelihood and their life? That's all I have to say. Thank you so much.
Sir, you're muted.
Reverend Carter, I believe it's your turn.
Okay, thank you.
I'm Reverend Tony Carter, pastor of Salem Baptist Church, and I certainly try to listen and understand everybody on both sides of the issue. But the fact is, we're all in this together, and what affects me affects you. And so, even though we don't live on the same street, and we certainly don't live in the same houses, the fact that somebody makes a choice to not be vaccinated or not to wear a mask or just ignore all of this because of their freedom is not good enough, because we're all in this together. So I'd like to speak out in favor of the mask mandate, because I have a 10-year-old granddaughter, and I'm really worried she don't have a choice about being vaccinated. And I'm worried about what can happen when she goes back to school. So I speak up in favor of the mask mandate and what Dr. Griner, Dr. Corvo, and Julianne have suggested. Thank you.
We have no additional hands raised online.
Thank you. And
I'm
now
sorry.
close.
I'm
Go ahead.
sorry, we just had a Donna Young raise her hand.
Okay. Mrs. Young?
Ma'am, you're muted.
Thank you. Thank you, Mayor, Commissioners, and the many public health professionals who are serving the community of Wyandotte County. And thank you for the opportunity to speak this evening. On behalf of the community health workers, community outreach workers, clients and staff of Community Health Council who have been on the ground from the very beginning of this pandemic, we want to just express our support for the mask mandate. We are absolutely in support of this effort. And we want to thank everybody that's been doing this work with us, all of our partners and the many people who are in this work every day. Thank you.
We have Beta Clean Air, now KC.
You're on.
Yes, hi. Yeah, hi. So I lead an organization called Clean Air Now in Kansas City, Kansas. Specifically started in Wyandotte County, in the communities of Argentine, fence line to industrial pollution, and environmental health inequities. And we are also in support of the mask mandate. We're tired of the misinformation across the aisle, the people in the lobby, raising these issues that have no basis, in our neighborhoods. That the majority are that we represent that are represented in Wyandotte are people of color, low-income communities of color. We need our commissioners, we need our elected officials to step up and enforce the mask mandate, because we need to save lives. We cannot be playing around with people's lives or putting a time or delaying anything else out there. We need to do this. We need to get over this hump and move forward. We cannot allow misinformation to fuel our elected officials, fuel our local government, fuel our schools, fuel anyone. So thank you.
Our next speaker is Brett Reimer.
Can you hear me?
Yes, sir.
Yes, sir.
Okay, thank you. I'm just trying to see where does it say that a mask will prevent a virus from entering your body? I don't see that anywhere on any of the information that's provided on the boxes of masks that come. And then in specific to children, there are no efficacy standards on child-sized masks and respirators under OSHA, but there are proven microbial challenges as well as breathing difficulties that are created and exacerbated by masking children. So requiring children to wear a mask sets the stage for contracting any infection, including COVID-19, and making the consequences of that infection much graver. In essence, a mask may very well put children at an increased risk of infection, and if so, having a far worse outcome. I am not in support of masking up our kids. Thank you.
Our next speaker is Caleb.
Yes, Caleb.
Can you hear me?
Yes. Yes, we can hear you.
I can't hear them.
Caleb, are you there? Okay, we'll move on to the next speaker.
Mayor, we have no other hands raised.
Mayor, the clerk's office did receive 2 comments that we need to read as well.
Thank you. Go for it.
First one is from Trina Miles. It says, "We as individuals know our health and health risk and are capable of deciding for ourselves how to protect ourselves. A blanket mask mandate decision does not take into consideration an individual's health. Some cannot wear a mask and should not be forced. Why are we not focusing on promoting prevention by getting ourselves in better health? For example, exercise, better diet, supplements to boost our immune system, etc. This has worked for me for well over a year, and I am in the group that would be considered higher risk. I have not been sick one day through all this. Thank you." The second one comes from Annalise Weens. "I support local health order as proposed on 8/5/21. Universal masking is not only necessary to protect the majority of eligible Wyandotte County residents who remain unvaccinated, but for all children under 12 who are waiting for a vaccine to be approved for their use. Until the time everyone has access to vaccination, masking is not a personal health decision. It is a public health decision that individuals are currently making, even though it is their role in our government to make public decisions, individuals, businesses, and school districts, and deferring judgment to what you, the Board of Commissioners, require because they trust the government to serve the public's needs based on the best information available. Thank you."
Okay, thank you. We now close the public hearing.
Mayor, Caleb has rejoined us online.
Okay, thank you.
Sorry about that. I think I can hear you now.
Go
Hi,
for
my
it.
name is, thank you. My name is Caleb Grable. I actually don't live in Wyandotte County. I live in Olathe, but I go to church in Wyandotte County. So I wanted to call in and share my opinion. The reason I stand strongly opposed to this ordinance to mandate and coerce the wearing of masks by both a threat of possible monetary loss and imprisonment is the same reason I would oppose an ordinance that mandates that masks cannot be worn. It is the right of the individual to make this choice, not the government or any governing body to make this choice for the individual. However, the most important human right that is being threatened by the implementation and enforcement of such an ordinance is the right of each individual to worship however that individual desires without the threat of government encroachment. This is in fact the most basic liberty that we are endowed by our Creator. Civil liberties are being encroached upon. To mandate the wearing of masks is to overlook and neglect the founding principles that our nation was founded upon. To presume that masks do not have trade-offs and do not inhibit the ability to worship however one pleases is simply wrong. And I can say this from personal experience with masks. I would implore this commission, please do not allow this ordinance to pass for the sake of our most basic human right to worship however we please. Thank you very much.
Thank you.
Mayor, we have an additional hand from Trudy Hall.
Okay, thank you.
Ms. Hall, you're muted.
Good evening. This is Trudy Hall. I'm a resident of Wyandotte County. I just wanted to speak to supporting the mask mandate. And I would just speak to the council that you are our elected officials. This is a public health issue, a public health crisis. And I think we have to consider the safety of the public. We're only asking people to mask in public places. If they don't want to wear a mask, they don't have to go to those places. No one's forcing them to. But in consideration of the health of others, I hope that as commissioners, you will think about this as a public crisis that we can address. We have the tools. And we should put first and foremost the safety of our community. Thank you for allowing me to speak, and thank you for your work and the work of our health caregivers.
Thank you. I now close the public hearing. All right. So Commissioner Kane.
All right, thank you, Mayor. As I called the state yesterday and they talked about that we could carve out certain things in schools was one of them. But obviously we heard a couple of other good ideas, which was Edwardsville and Bonner. So I'd like to make a motion to carve out like Bishop Ward, Donnelly College, the community college, the Piper School District, the Catholic grade schools, the private schools, Edwardsville and Bonner, since they have their own board, to let them make their own decision.
So we have a motion.
That's the motion.
And so it is to adopt the public health order as proposed with those amendments? Yes, right.
All the other school districts.
All the public school districts.
All the public school districts.
And we have a second.
I'll second that motion, but it's also my understanding that some of them have already made some decisions, and I don't want to encroach upon that, saying one way or another, but I do agree with the motion that has been made, and I will second it.
Commissioner Ramirez.
I don't have to do that through Zoom anymore. Thank you, Mr. Mayor. I'm just gonna state real quickly, since, you know, in the lobby, my comments and my name was brought up. I stand by what I said. If this vote is what gets me unelected in 2 years, I will stand by that vote till that day. Because I said when I ran for this office that I would operate with honesty and integrity. And part of my integrity is protecting this county. And my honesty, I have been honest since I have been on this board. And you all know that I will continue to push and fight until I have nothing left. I was almost discouraged in fighting tonight. And that's a disservice to my district when I get discouraged, because then they no longer have a voice on this board. Again, choices. What's right, or allow politics to play in this. Thank you.
Commissioner Philbrook.
So I have a question real quick of our lawyers. So in the past, we had determined that, if I remember correctly, that we were not supposed to be able to rule over churches, what churches do within their walls. Is that still true, or did that change, or what happened?
Commissioner, the Supreme Court has upheld certain restrictions within churches. Where some states got in trouble was when they started treating churches differently than other entities and other businesses. And that's where the Supreme Court struck down some restrictions when they were not treated the same as others.
Okay, so under this, all entities are treated the same.
Correct.
Therefore, churches are not out of the realm of our decision.
Correct.
Okay, I just wanted to make sure that I understood and that other folks understand. Okay, thanks.
Commissioner Bynum.
Thank you, Mayor. I think I might be making things more complex than they are, so I apologize for that. I support the motion. Senate Bill 40 had specifically carved out authorities of school boards.
When they were under the state of emergency,
correct,
they had sole jurisdiction.
And we.
Commissioner Bynum, will you pull your microphone?
So there is nothing in current state law that keeps us from the multiple carve-outs we've made a motion and a second for. Then we can carve out the cities of Bonner and Edwardsville.
That's correct. You have complete discretion to approve, deny, or modify the health officer's order.
Okay, thank you.
Commissioner Townsend?
Thank you, Mayor. I had a question about the motion, and Commissioner Kane mentioned, was it Ward? And some, okay. As opposed to some of the other entities named that had their own boards. Explain to me how that would be. Okay, I didn't know. That's why I was asking.
St. Pat's got its own board. You know, the other, all the schools that I know of, the Catholic schools have their own board.
Who can make decisions for their, okay, all right.
My wife is on the board of Christ the King. They're elected just like we are.
Okay. Thank you for that, because I didn't understand. I do feel, though, that when we carve out these exceptions, we weaken in some ways the effectiveness of what can be achieved countywide. What we heard tonight from the medical professionals was based on what was going on countywide. The numbers quoted were countywide. And we all are free as citizens of the United States to go from city to city, county to county. So I am disturbed, or I'm still, considering what this means if we start to carve out these exceptions, not knowing what those entities may do. I'm concerned about the overall effectiveness. I looked at one of the graphs presented tonight. It might have been one of Dr. Steitz's graphs, and it showed where back around April, we were seeing decreased incidents, the positivity rates were going down, but COVID had gone nowhere, and we missed the opportunity back in April to extend it. Who knows what may have happened with these rates now, had we just extended it for a little bit longer. But now the numbers are up. It was interesting to hear that just since we last considered whether or not to move forward with the mask a week ago, that Dr. Seitz said we're up 32.89% in the number of COVID cases. So I would prefer to see us have some mask mandate than none at all, but I am concerned that if we carve out, we may not be as effective with what we can do. And that's what our medical professionals have said, that using the mask will increase the effectiveness of what we can do against this disease. So thank you.
Mr. Bach, you needed a clarification from legal.
Thank you, Mayor. Patrick, I just want to clarify or get your legal opinion back to the governing body. If we were to move forward with those carve-outs, is it better for us to do so and make this as an ordinance for the city of Kansas City, Kansas, versus doing it as a county with all the carve-outs of the other cities?
Sure. So, Mr. Buck, the benefit of doing it as an ordinance is that we would not be subject to the expedited judicial review provisions of SB 40. Now, we don't have an ordinance prepared, so we would have to come back and bring that ordinance, and it would take some time. But a city can pass an ordinance through its home rule powers that covers everything that the motion covered. Now, someone could still probably find a way to challenge it through some type of injunction. So we wouldn't be completely immune from a challenge, but it wouldn't fall under the fast track review that's been so controversial under SB 40. That would be the one benefit, but we would have to go back and draft that ordinance.
Okay, I would not be in favor of not making a final decision tonight.
Commissioner Philbrook?
So as usual, I have the question of what if? So what if we go with what is suggested tonight and the amendments to the original? and we do that. And then we find out that it doesn't accomplish what we need to, let's say in 2 or 3 weeks, and things are still, can we come back to the table and make it more encompassing? That's my question. Are we stuck here with this decision tonight, or are we capable of amending again if we feel and find out that our carve-outs are a problem?
You can always come back with a modified health order, Commissioner.
Okay, I just want to make sure that people understand that and that we understand it. So thank you.
Commissioner McKiernan.
Thank you, Mayor. I do appreciate all of the comments that were made tonight. I appreciate the input. For those of you who in Wyandotte County who are already vaccinated, I thank you. It frankly stinks that we're all facing potential new restrictions, but I thank you for doing your part and for investing in your own health and the health of our community. For those of you who have not yet been vaccinated because there was some sort of a barrier that prevented you from getting that shot, please let us know what barrier you faced. We are committed to knocking down barriers and getting the vaccine to anyone and everyone who wants it. For those of you who have not been vaccinated because you don't believe in it or you don't think this is a real virus or that it won't affect you, I know there's nothing that I can say that will convince you otherwise. So I'm just going to do what I think is the right thing to do for the health and well-being of the people of Wyandotte County. I am a scientist and an educator by background, and for my entire career, I've done my best to be driven by data. I believe the current data are clear that our healthcare system is getting overloaded to the point that if I have a medical emergency tomorrow or next week, I may not receive the timely and potentially life-saving medical treatment that I need to survive. I believe these data are clearly making my decision for me. And I strongly encourage the jurisdictions who we have left out tonight to consider these data and to consider the health of your respective constituents as you make or don't make your individual decisions. Thank you, Mayor.
Thank you. I'd just like to comment that, throughout this pandemic, we have always, every time that we have given this virus oxygen, it has flared up. And so that's exactly where we are again. We have a new variant, which is 5 times as transmissible as the original. If you look at areas or jurisdictions that had mask mandates and compared the business activity of those jurisdictions with neighboring jurisdictions that did not have mandates, there was only a slight difference in business activity, because what is driving business activity or inactivity for that matter is the perception of individuals that it is safe or not safe to go out in public and to do certain things we're used to doing. So the mask mandate simply for us is a way to signal and to enforce that everyone needs to be there. In most cases, people have adapted to the mask and have found that, in fact, and we have the data demonstrates time and again that the mask does work. So I support a mask mandate. I believe it is necessary. We have to protect our citizens, especially those who cannot protect themselves. And, the question of whether this is constitutional, I think we need to go back to the preamble of the Constitution, which simply states, we, the people of the United States, in order to form a more perfect union, ensure domestic tranquility, provide for the common defense, promote the general welfare, and obtain for ourselves and our posterity the blessings of liberty, to hereby ordain and establish these United States of America. To promote the general welfare is a fundamental principle of our Constitution. So let's keep that in mind. This was never intended, and no commission here, no person on this commission ever did this in order to take away anybody's rights. It was always reaching for a vision of what we could be if we would take care of one another and prevent the spread of the virus. We have to remember who our enemy here is. It is not one another. It is the virus itself. The virus is going to do what the virus does. We need to pay attention to it, find out how it moves, how we can get out in front of it, and do those things so this no longer oppresses us. The virus is doing this to us. We are not doing this to one another. So we have a Commissioner Johnson?
Sorry, Mayor. So just for clarification, Kansas City, Missouri has an indoor mandate in public spaces, and Jackson County, Missouri has an indoor in public spaces. And we are considering just something specific to Kansas City, Kansas, but not Wyandotte County, Kansas. I will say that I share the same concern that Commissioner Townsend shares in terms of how this potential ordinance will be is weakened by ignoring the others that have their own governing bodies. However, I think we, in the interest of time, need to move forward with it. But I will say that as a pastor who has gone beyond the science and had the sobering responsibility of burying persons, performing funeral services for persons who have died from and succumbed to COVID-19, there is nothing more sobering than having to do something like that. And so I am certainly in support, if I haven't said it, of the mask mandate. I'd like it to be countywide, but I will do the best I can to try to consider what's been set before us tonight. Thank you.
Commissioner Townsend?
Well, just a point of clarification from what Commissioner Johnson said. I'm understanding that this is still a countywide, but we have carved out, or the proposal is to carve out exceptions to that. Is that correct?
Well, I think the motion has essentially made it a citywide. only.
Okay. All right. Thank you.
All right. Yep.
So what about Loring? Loring's not a city, it's part of the county. I'm just saying, guys.
Well, I asked the maker of the motion, Commissioner Kane.
No, that's county. So I guess really the question is that really it's still kind of county because Loring's part of the county, right?
Well, I guess I'd ask for clarification on what the intent.
No.
No.
All right. So it is not to basically, Patrick, what you had said would have been, but with Loring not incorporated, still under the county, it is still a county ordinance with carve outs.
So this will cover Loring. Yes.
Okay, just making sure.
All right. We have a motion and a second. Roll call, please.
Roll call. McKiernan.
Aye.
Ramirez.
No.
Johnson.
No.
Kane. Markley.
Aye.
Walters.
Aye.
Philbrook.
Aye.
Bynum.
Aye.
Burrows. Townsend.
Aye.
Vote is 8-2. That motion carries.
All right. Thank you very much. That takes us to the next item. A continuation of the July 29th, 2021 public hearing to consider
Mayor.
approval of the Community Development One-Year Action Plan. I'd ask Mr. Bach to take some opening remarks.
Whoop. We're not going to. We don't want to talk about some of the other issues that cropped up from that, or no?
No, we passed the ordinance. We're going to move on to the next item.
Thank you, Mayor. Last week, we started a community public hearing regarding the community development grant or community development funds. Mission took the action to table that item this week and bring it back to this week to a special session. Tonight, I've asked Ms. Miller to come forward and make just a couple of brief comments regarding a few things regarding this process, and then we will open it up to public comment. Ms. Miller?
Thank you, Mr. Bach. Good evening, Mayor, Commissioners, County Administrator, and visitors. For persons that weren't here, the Unified Government of Wyandotte County receives an annual allocation of entitlement funds from HUD for the following programs: Community Development Block Grant Program, the Home Investment Partnership Program, and Emergency Solutions Grant Program. To receive these funds, we must submit an annual action plan to HUD, which consolidates all of them into a single application and includes a description of the projects and activities expected to be undertaking using these grant funds and any expected program income. The plan also includes actions that the UG expects to take during the program year to pursue strategies described in our 2015 5-year plan. The UG must hold 2 public hearings to inform the community about the plan process, and to obtain community input. The first public hearing was held on March 12th, 2021, prior to developing the plan. The Community Development Department made a presentation to the Administrative and Human Services Standing Committee on May 24th of this year. The presentation included a description of the draft of our 2021 budget, which included these 3 grant programs. This meeting was held on Zoom and broadcasted live on UGTV and the UG's official YouTube channel. There were no public comments received at that meeting. From that meeting, the Standing Committee voted unanimously to approve the draft consolidated plan and forward it to the full commission to set a public hearing date of July 29th, 2021. And that was completed on June 10th at the full commission meeting. The draft plan was published on June 10th, 2021, and citizens were given 30 days to comment. The summary of that draft plan was published in the Wyandotte Echo, the KC Hispanic News, Dos Mundos, Livable Neighborhood Newsletter, and the UGE News Source newsletter. Publication was submitted to the Call and the Globe, but both outlets were not responsive to the request. Public comment period began on June 11th and ran until midnight on July 13th. No written comments were received regarding the draft 2021 annual action plan. The second public hearing was held on July 29th, along with tonight's continuation of that hearing, which will fulfill the second public hearing requirement. Let me see here. Formal notice was published regarding the second annual action plan public hearing in the Echo, Dos Mundos, and KC Hispanic News. Notice was submitted again to the Globe and the Call, but they did not respond to our request. Notice was published in the Livable Neighborhoods virtual newsletter on 2 occasions. Notice was published in the UGE newsletter on 2 occasions. A Facebook event was published on the UG's official Facebook page, and the public hearing was informally advertised by community development during various community meetings and with partner organizations. The 2021, tonight's meeting was determined on the July 29th public hearing notice. Notice was posted on the UG website under events on page 1 of the website and on the UG clerk's page. Finally, the notice was published in the UGE newsletter that went out earlier this week. The 2021 plan budget is summarized by the slide that you can see and is shown by grant programs and activities. The community development grant was $2,362,404. The home grant was $882,359, and the emergency solutions grant was $196,560 for a grand total of $3,441,323. In addition, we're also including $470,000 of 2015 grant funds that require programming to meet deadlines. The funds were originally slated for housing activities in District 1 and 6, but will be reprogrammed to public facility and improvements in District 1 and 6. These activities can include construction, reconstruction, not maintenance, of infrastructure such as parks, recreation, and community facilities, curbs, sidewalks, and street improvements. The plan must be submitted to HUD 45 days prior to the fiscal year that starts October 1, which means submission can be no later than August 15, 2021. Failure to do so will automatically result in a loss of funds. A resolution calling for the adoption of the 2021 annual action plan and attachments is being presented for commission approval after following the public hearing. This concludes my presentation. Thank you.
All right, I now open the public hearing. Before you take public comments, I'd ask the clerk to read the statement governing the public hearing.
Thank you, Mayor. Good evening. We would like to welcome all present to the public meetings of the Unified Government of Wyandotte County and Kansas City, Kansas regarding the Community Development 2021-2022 Annual Action Plan. We appreciate the attendance of everyone here this evening, and we recognize the importance of your views. We would, however, remind you that there are 3 individuals signed up to speak this evening. Each person will be allowed 3 minutes to speak. Should you reach the 2-minute mark, I will announce that you have 1 minute remaining, which should allow you time to wrap up your comments. Once you're recognized, please state your name and city for the record. We would also appreciate your efforts to be considerate to all during their comments. We also ask anyone with a cell phone to please turn them off or switch to non-audio.
Right. Is there anyone on Zoom who would like to speak?
Mayor,
So
we have
please-
Denise Tyler.
Thank you. Denise, please go ahead.
Hello,
State your name and city of residency, please.
Can you guys hear me?
Yes.
Okay, yes, I'm Denise Tyler. I am the Executive Director for Northeast Economic Development Corporation in KCK. My comment on tonight, I want to thank you for spending time on letting us know how you notified us about the block grant. I believe the communication of what we were requesting last meeting, once again, was not clear. We understood the block grant, but what the grievance was is that we were given information on how to join and give input, not only on this grant, but also on the recovery plan. And we wanted to make sure everyone's voice was heard, even on the recovery plan. And I think this special meeting did not do it justice, being that we spent 2 hours on the mask mandate that we did not know was going to be a part of this meeting. So while the community block grant, I personally do not have an issue with what's being proposed, and that wasn't the grievance that was brought forth from me last session. It was more around the communication of how one can join, and it wasn't available. So I wanted to put that out there that although you gave information on how information for the block grant originally was asked for input, I think we need to do a better job at getting the word out better to more in the community. Now, I've extended my offer to the mayor. I have not received a call back from you yet, Mayor. So this is my public cry to you to please give me a call. And then I also sent a email to Wilbur Miller, and I think she copied your communications person, and I have not heard from anyone. But we do need to have a better job of communicating with the public so that they don't feel left out. And that's all I have to say tonight. Thank you very much.
Yes, and Denise, to be clear, though, that what you sent to me was sent on to our communications, which is her responsibility to deal that. That is not what I would do, but I would support any efforts that you would bring forward.
Absolutely. But I've contacted you about something else, but we can. Now you know I've been looking for you, so I'll try you on Monday or tomorrow.
All right, I got you.
Thank you.
Our next speaker is Dustin Hare.
Hey, Dustin Hare, co-founder of WICO Mutual Aid. When the UG was soliciting community feedback regarding the 2021 budget, I submitted a request for permanent water stations and sanitation facilities at the bus stop at 7th and Minnesota. This is a priority that has been communicated to me by several people who frequent that location. Tonight, I'm here to request that CDBG funds earmarked for public facilities and improvements be used for that purpose. Throughout this summer, WICO Mutual Aid has been delivering bottles of water to both commuters and unsheltered folks on a daily basis, a task that is necessary to keep people from getting sick and dehydrated during the summer heat. These are resources that are donated by the community. Providing water stations would free up these funds to be used in more productive ways, and it would also cut down on plastic waste that otherwise won't break down for about 450 years. Last night, we convened 600 unsheltered community members to talk about their experience with the criminal justice system. A lot of valuable information was shared regarding experiences with courts and policing, but the conversation consistently veered to the need for bathrooms. This is a top priority for people in Wyandotte County who are experiencing homelessness, and it has also been identified as a need by commuters who often spend 30 minutes to an hour waiting at the bus stop. As it stands right now, people are forced to use the bathroom outdoors in public in an area where people are congregating. This is not only dehumanizing, but it's extremely unsanitary, and it can lead to the criminalization of people who just need to pee. I don't know the exact cost of these amenities, but it seems like they'd be relatively inexpensive to install, probably in the ballpark of $10,000 to $20,000. I'm hoping CDBG funds earmarked for public facilities and improvements can be used for this purpose. Thank you.
Thank you.
Our next speaker is Carolyn Wyatt.
Go ahead, Mrs. Wyatt.
Hello?
Yes, we can hear you.
Okay. My name is Carolyn Wyatt. I live at 359 Troop Avenue. And I talked the other day, but what I want to say is that I was driving. What I want to say is that the allocation needs to be divided between District 1 and District 6. I'm not sure how much money it is, but if that it is, we would like to divide that in half. Edgerton Park has a tin roof, and the roof is leaking. The roof is leaking. Rocks are falling. It needs new play equipment, a baby swing, and adult swing. Parkwood Park needs either new pool or upgraded on the pool. It needs new equipment and a shelter. Boston Daniel Park need an upgrade on it. The Northeast Master Plan, there should be a grocery store within that, a full line grocery store.
Mrs. Wyatt, you cut out. We're not hearing anything more. Okay, let's go ahead and go to the next.
Our next speaker is Broderick Crawford.
Well, once again, good evening, Mr. Mayor and Commissioners. Thank you all for your patience tonight and getting through all of these issues. I will echo this. Broderick Crawford, Kansas City, Kansas, NBC Community Development Corporation. I will echo both Tanise Tyler. Again, my concern that I expressed last week was how we are intentionally engaging communities that aren't on the normal media sources. So folks who may not have broadband, folks who may not read the multiple newspapers that was quoted, the fact that the two African-American newspapers, it was said they didn't respond, but I think if I needed to get something in the Call in the Globe, I could do so. So I'm just saying, we need to be more intentional, less about what's easy for us or easy for staff and what we need to do for community. I will also echo the sentiments of Dustin. There's too much unhoused in our community and we need to do more. We need to do more. We have the ability to do so. Do we have the wherewithal to do what's right? In the previous conversation, when you're in positions, it is difficult, but it is your obligation to do what's right, not what's nice. And what's right is to take care of all Wyandotte County residents and not just those that are fortunate or those that have the niceties that others have. It is our obligation. I'm in this with you. It is our obligation to take care of all, not just a selected few. Thank you for your time and thank you for all that each of you do in this community.
Our next speaker is Elnora Jefferson.
They knocked me off.
Good evening.
Hello?
Okay, good evening and thank you. Over the years, good evening and thank you, Mayor and Commissioners. Sorry. Over the years, CDBG has been used in various ways in low and moderate census tracts. Demolition of homes is one. A 10 to 20 year or more review of the data will prove that a great number occurred in Northeast KCK. Today, there is a movement to repopulate the Northeast neighborhoods with brick and mortar. Investors and housing developers at home, and particularly from outside Wyandotte County, are biting at the bit for an opportunity to make money by developing residential homes and complexes on virtually friendly land. Yet, those citizens who stayed, the old-time investors of sweat equity, paid taxes, faithful voting, The recipients of years of unfulfilled promises are intentionally excluded from a much-earned opportunity to have a say in their neighborhoods. The irony is that this is not the developers, but the neighborhood people who are the seminal sources of what quality of life means, what it looks like, what it feels like in a place where they live, work, play, and worship. In your allocation of CDBG funds, please allocate money to support the Northeast neighborhoods compilation of their quality of life plans, because this is your real source blueprint. If you give the neighborhoods a chance to be valued for what they know and for what they can and want to contribute, you will be surprised at the tax base that you will grow and how the county's overall cumulative health will rise, because the fundamental underbelly of development will be overlaid with ground up and inside out neighborhood value in the neighborhoods where the people choose to stay, and they chose to stay, to live, work, play, and worship. Thank you.
Thank you.
Our next speaker is Rachel Jefferson.
Go ahead, Rachel.
Yes, hi, sorry, I have to just switch over. May I ask a point of clarification?
Sure.
The slide that we saw, was that also for the recovery funds as well as the annual allocation?
No, that was not.
Okay. So I want to echo what I heard from the other public comments today. I agree that there needs to be greater transparency and openness around communication. And I think there are many, first of all, I want to say, I think staff is well-intentioned in putting out their communication. And I think that there are also many willing and able community organizations who will help to spread the word of these public hearings. So I would ask that the commission consider for the next annual allocation, working with those community organizations to get the word out on the ground, boots on the ground about how these dollars are spent. I would also like to see how the dollars for the recovery funds were decided, because as I understand, all the public notices that were listed before, and there were a great deal, were in regards to the annual allocation plan. I would be interested to know what type of outward communication was provided towards the recovery plan. I would like to second that there needs to be dollars put into parks and facilities. Edgerton Park is a great park that Ms. Wyatt has spent a lot of time and dedication to. I want to second Dustin Hare's comments about providing for the lesser of us. I want to second that we need neighborhood plans, especially as we look at the increased infill development that's coming into the Northeast area KCK. And I also want to second that there needs to be dollars put into a grocery store in the Northeast KCK area, as we know this has been a long sought after need. So I guess those would be my seconds. And then I would also ask that we could get more information about the communication process, the public hearing process for the recovery funds that the Community Development Department received and how those were decided upon. And finally, in summation, I would like to say that we could—
Ma'am, you have 1 minute.
We could consider adopting a public participatory budget process in the future where the community can have a say directly in how these dollars are spent. And I think that would add greater transparency to this whole process and prevent some of the frustration that we see coming from the community in terms of not feeling like they are included in this decision making. Again, I thank you all for your time and what you do for the community, because I know that it is not an easy job. Thank you.
Our next speaker is Melvin Williams.
Thank you for having me. How y'all doing? Can y'all hear me?
Yes, sir.
Okay. 43rd and Leavenworth Road area. I agree with Rachel and Carolyn. Parks and Recs is where we need it at. Swimming pool, of course, update and upgrade. And we're all saying the same thing. We would like a grocery store in the Northeast area. You know, we need it. We're a food desert. And a couple other things is, I think we should have more programs to help the seniors out, because a lot of their kids that moved out of town, so we could help them fight the fines and fees that go along with not being able to upkeep their property, far as cutting the grass and cutting vacant lots within the northeast area, because them are often left out. So that's where I want to see it go. Parks and Recs, the swimming pool, hopefully a grocery store one day, helping our seniors and helping maintain vacant lots around the area. And I thank you.
We have no other hands raised and no one in the public lobby.
Could we ask if Carolyn Wyatt is still on, if she would like to finish, because it did get cut off? Is she still showing as a participant, attendee?
Ms. Wyatt, you've been promoted.
Mrs.
Ms.
Wyatt?
Wyatt,
Carolyn, if you're still there, you got cut off. We would like to have you finish.
Yeah, I'm still here.
Okay, yeah, well, you got cut off, so let's go ahead and you have an opportunity to finish what you needed to say.
Okay, appreciate it. The last thing I was talking about was Beatrice Lee Community Center. The bathrooms are not ADA certified. Person in wheelchair cannot go to the bathroom, or if they handicap. The ramp in front of the building has cracks in it. It's unsafe. The city has ADA money. Maybe the county don't for it, but the city has ADA money. So why not use that money for the safety of the people that are coming to the center? And I did say something about Boston Daniel. I think I've said something about that. I think that's all. I just wanted to get that in. Appreciate it very much.
Thank you.
You're welcome.
All right.
we have another speaker, Beta Clean Air.
Yeah, hi, good evening. My name is Beto with the organization Cleaner Now in Kansas City. We, as an environmental justice organization in Wyandotte, I echo the concerns of others in this hearing today. Rachel and Broderick and others have concerns about greater public participation and the way the process is, to make sure that community is involved along the way and where this money is allocated. And specifically, I want to talk about the American Rescue Plan, where that money is, how it's going to be utilized locally. We have a lot of concerns, not just my organization, but a lot of the organizations on this here today, concerns of how that money is going to be utilized. And we really want to make sure that if this money makes it to the right places, not just to the few wealthier parts of Wyandotte County, right? We want to make sure that it's destined to the environmental justice communities that have been suffering for so long. I also wanted to add that we recently we're working on, along with Armadale and their general plan, we recently submitted a report of the environmental justice concerns. I know that we always think about economic growth and economic prosperity, but we also need to think about the health of our constituency, of our residents in the community. So I would like to submit that letter, also that report, to the here as well, for the record, and I'll submit it, I'll email it, because I think, it gives a context, not just of what's happening in Armourdale, but along in other, even in Argentine, Turner, Northeast. So a lot of different places look similar, right? I want to make sure that the organizations on this call today, and including ours, Cleaner Now, are part of those decisions when you decide where the money is going to go for the rescue plan. And I can tell you right off just knowing that sidewalks is something that is needed in a lot of these communities. There's a lot of safety issues that need to be addressed. There's truck traffic that is in these communities that is tearing up the streets, and not just tearing up the streets, but impacting people's health with air pollution. As you know, these trucks are destined to ride to these vulnerable communities. They use these highways as if it was their warehouse. I mean, who is paying for this? I hope you guys aren't footing the bill for this, because they are using those roads for their benefit. And so,
Sir, you have 1 minute.
Thank you. Yeah, so I just wanted to add, that we hope that the process moving forward in how money is allocated, that, there's possibly a way to create a committee of organizations that can inform and help inform that and share that information out. And like Rachel said, maybe there's a monetary budget for public participation to help in that process, because we really need to make sure that we meet our community members where they are, where they live, at the hours that they're available. Our community members are struggling to survive right now. They're struggling to stay afloat through this pandemic with energy insecurity, housing insecurity, and we need to meet them where they are. And I don't think the traditional social media and stuff is doing that right now. So thank you. Just wanted to share. Thank you.
Mamie is our next speaker.
Hi, yes, this is Mamie Spring. I was just wondering, could some of the money be used as far as Black-owned businesses on the Quindaro area? That's all.
Wilbur, can you answer that question?
We do have the ability to do economic development activities. There are a lot of strings attached to them. I don't know all the specifics right now as we're speaking here today, but if we wanted to set aside money, we could, look at the economic development feasibility. Unfortunately, with HUD, sometimes they have to ensure that the small business hire so many people for every so many dollars that they receive, whether it's a grant or a loan. But that is something we could look at. We're getting ready to start our 5-year plan. After we adopt this plan tonight, we're getting ready to go into the plan process. And we're taking notes about how the public needs, to be a part of that. And that's something that we could probably address during that time.
Okay, thank you. I just feel that there's a lot of businesses on Quindaro that could benefit for this money as well, that are Black-owned businesses down that area. Thank you.
Mm-hmm. We have no other members of the public requesting to speak.
Thank you.
Mayor, we do have 2 that need to be read that were submitted to the clerk's office, if I can do that.
Please.
The first one is from Brenda Shivers. It says, program funds need to be used in districts 1 and 6. Number 1, Beatrice Lee Community Center, the restrooms upstairs and downstairs need to be made accessible. I'm suggesting that each restroom be accessed by a professional organization such as the Whole Person prior to the change, then based on the recommendations of the organization be converted. Number 2, free summer day camps in the neighborhood parks and community centers. The city has charged at a one time as much as $40 a week per child. This fee prevented a number of children in the Northeast community from participating. I believe such a well-run program will benefit our youth. I would recommend the overseer of summer youth camps be qualified and developed with staff, the same curriculum for all parks. I would like to see these reprogram funds spent in District 1 or District 6, again, unlike federal funds, such as the Opportunity Zone designated for the low income areas and spent elsewhere. Although the Department of Economic Development assigned to oversee the funds was aware of the project, ready project for in the Northeast, they chose to go elsewhere. The American Rescue and Recovery Plan Act, President Biden last Thursday said he would like to see local governments offer a $100 bonus to persons getting the vaccination. Since Wyandotte County is ranked the lowest getting vaccinated in the metro, I would like to see these CD funds utilized with some of the UG's ARPA funds to implement Biden's recommendation. Thank you. The second is from Ms. Taylor Walsh. To whom it may concern, I am writing as a concerned citizen in Wyandotte County in regards to community development block grant. I would like to share my input about how the CDBG funds should be allocated. From what I can parse from the action plan, there are a lot of great ideas included already. Your goals and outcomes seem to align with what I've heard in the community. However, the programs that are listed don't seem to be effective methods for truly meeting those goals. The final project is the most disappointing aspect of the action plan. Our children don't have parks or trails or functioning community centers. Our neighborhoods don't have usable sidewalks, and our streets are crumbling. Our historical sites and parks are not well maintained. All of these things play an important role in the death of a community's vitality. I understand that the deadline for this plan is rapidly approaching. I hope you can make it a priority to reconfigure this plan so that it truly reflects the needs of the people. I'd also address the importance of citizen participation in this process. It seems as though you intended to reach the community, but what was your true impact? Did you receive any feedback from the attempts that you made? Did the feedback reflect the appropriate percentage of all of the people in your community? Can you have done more to ensure that everyone had a chance to share their perspective? Recognize the importance of their involvement in this process. These are the questions that I hope you can reflect on and consider in your future attempts to hear the voice of the people. For Wyandotte Taylor Wash, thank you. That's all, Mayor.
Thank you. Now close the public hearing. Do any members of the commission have any questions or comments? Commissioner Bynum?
Mayor, thank you. I have a lot of questions. So first of all, Wilba, if you could put or whoever's controlling the slides, if we could see the slide again that had the breakout. I'm going to say my thoughts and ask my questions and then let you answer, and hopefully the commissioners chime in with your thoughts. So your reference number one, this money is from the federal government and has lots and lots and lots of rules attached to it. And so many rules that it's really, really hard for us to discern. And probably even harder for the public. But part of what you're being shown here is some of the allowable expense categories, if you will, allowed by HUD for these community development block grant dollars. And you can see that, for example, parks, curbs, sidewalks, infrastructure, we have put that into the specific NRSA category because those things are allowed. And that, I think we're in our final year of allocating that money into a specific targeted area of Wyandotte County, which exists mostly, I think, within District 4. So again, these breakdowns that you see are the allowable areas for expenditure of these HUD dollars. These are not bad places to put this money. Willa Gill, for example, does an enormous service to our community here in Wyandotte County. The emergency solutions, this funding assists with our homeless population. So these are great places. The emergency home repair program is phenomenal. I like the notion of a public participatory committee in future years of this. And Ms. Miller alluded to the fact that we're going to begin our new 5-year plan. That's a perfect time to bring in a wider cross-section of our community and have a deeper conversation. But we're all going to have to start with sort of a primer on what HUD allows money to be spent on. And so I heard a lot of great ideas, all worthy tonight. And now we need Ms. Miller to tell us, which of those might qualify, if you will. Wilba, I need help because I don't understand yet. You're speaking of the reallocation of dollars that need to be spent in District 1 and 6. And I think it's because there were projects or programs in prior years dedicated for those two areas that somehow did not come to fruition. And I just need you to help me understand. And lastly, and confirm for us that because those projects were allocated in those two districts, that's where those funds are going to go. Those funds are going to stay in those two districts. And the last thing I'm going to say is Elnora Jefferson asked for support for the Northeast Neighborhoods Quality of Life Plan, and I need more information. Are you referring to a LISC Quality of Life Plan? Is there some other Quality of Life Plan program that Elnora, your neighborhoods are seeking to undertake? What is the dollar amount of such a program? So I just need more information on that. And with that, I will turn it back to you, Mayor. or Wilba to answer the questions.
Yes, this goes, Wilba.
Okay, thank you, Mayor. The categories that you see here in the bold are actually HUD approved activities. The things under them are actually projects that are part of our budget this year. So when you talk about park improvements or economic development activities or grocery stores, only community development funds can be used for that. And we received, I'm trying to look at the amount, a little over $2 million. Hold on one second. $2.3 million. And we are in the 5th year of our NRSA, the Park Drive NRSA. Yes, we did have an issue with reprogramming some funds. Both activities, one for District 1 and District 6, both did some activities and successfully completed some, but there was a deadline on how long they could use those funds. And in order to meet deadlines, we had to close those out, and then we reopened them back for those 2 districts to be able to use them. And it seemed that parks and curbs and sidewalks was a much more cleaner and neater way to spend the funds quickly. Because as you recall, we were under a timeline to spend our monies. And every year on August the 2nd, they look at our timeliness of our spending. And as you know, last year, because of the shutdown and COVID and staff not being able to go into people's houses, that we were slow, so what we're trying to do is get back into things and get things going again. Home investment partnership programs can only be used for housing related activities, and emergency solutions grant can only be used for homeless activities. These are just the annual plan. The American Recovery Act or any COVID funds were not a part of this annual plan.
Wilba, my only remaining question is, again, the District 1 and 6 money is the 570,000?
No, it is actually 470,000 of prior year's money, so it's not showing on this budget.
Okay.
The 570 is Park Drive's last year.
NRSA, okay.
NRSA.
And
the 33,770, I'm trying to remember now. I don't have staff with me who put together the budget, is another project that needed to be finished within the next year.
okay, but the 470.
70,000.
Thank you.
It was actually
That-
2015 funds, and it can't go into the action plan budget like this is reflecting.
Okay, so are the District 1 and 6 commissioners going to be working with you for expenditure? Or they've already
started
done
working
that?
with me.
Okay, and
Yes.
we're doing curb, sidewalks, infrastructure things.
We haven't settled on some
Okay.
things. We've been talking about park improvements. right
Okay,
now.
no problem. I think I've spent enough time. Thank you.
Okay. Seeing no more hands raised. Oh, Commissioner Townsend, sorry.
Thank you. That's a good slide to leave up, and I thank Commissioner Bynum for her intro and to all of the persons who expressed concerns and needs about how and where to spend this money. For clarity's sake, what you've got up there is the action plan for money that has already been committed or not, or going forward.
This is the application that we're going to be submitting to HUD if you approve it tonight. And then they will typically send back a grant agreement if they are in agreement, and the mayor signs it, and then we will be able to start our process as far as developing contracts, doing any environmental work we need to do. And this money is generally in the budget by the time, like if we were in the normal process, these funds would show up in your 2022 budget. Because by the time we apply, HUD reviews, offers us the grant agreement, we go through all of that. It's usually the first of the next year or late December before we get the ability to actually spend these funds. But meanwhile, we're still spending older funds.
Okay. And with regard, for example, there was any number of call outs for improvements to parks. What you've got there is part of park improvement in the last year of this 5-year plan that's
Right.
already been committed. Okay.
Right.
But I will say that some of the things that were called out tonight, like Edgerton and Parkwood, that will be, and I've asked for that to be looked at with budget funds from ARPA money. So this would not be the only opportunity to have that discussion. With regard to the swimming pool, you see here, we've got a grand total of $3.4 million. And
But
this
only-
is
Remember, only 2.3 can be used for those kind of activities.
right, but I'm just saying in total, that's what you've got. And my point is this, that I think with the swimming pool, that would be the thing that I would ask staff to come back to us at another time in a special session to talk about, let's say, what an aquatic center, say in Bonner Springs, look like. We have no idea at this point what an upgrade would look like or something that the community would like to see with a revitalization or a new pool. So I think while that's a good ask, that's not this. I would bet that a whole new aquatic center would be 3.4 million at least, or a good part of that. And that's why I brought that number up. The other thing, and I think one of the last commenters brought this up about participation. We started this back in March. I am all for participation and how we could do a better job and how we have done or can do a better job for this next cycle. So for instance, the next cycle would be what again in March, February. It is very difficult, and we've gone through this any number of times with the main budget. You know, if you're participating early, and I get what some of the callers were saying, it's how we're communicating that. I think that's one of the most important things we can address about how to get that out so community participants can come forward earlier in the process and participate. One thing, I had a question about something that I think it was Mr. Hare asked about, the water stations. That type of expense would come out of or be closely associated with the emergency solutions grant type of spending. Is that correct?
I don't think we can.
For homeless?
I don't think we can do physical improvements with the homeless dollars. That's more
Okay.
direct, rapid rehousing, prevention. I can't even think of them now. There's like 4 active case management, street outreach. We can't actually do, as far as I know, any capital improvements with those funds.
So if not here, then that might be something suitable for broader discussion with ARPA funds or the budget discussion. That be correct?
Yes.
Okay. All right. Thank you.
Mhm.
Okay. I'd entertain a motion.
Second.
A motion to approve the CDBG action plan for 2021-2022, correct?
Thank you. Roll call. McKiernan.
Aye.
Ramirez.
Aye.
Johnson.
Aye.
Kane.
Aye.
Markley.
Aye.
Walters.
Aye.
Philbrook.
Aye.
Bynum.
Aye.
Burrows.
Aye.
Townsend.
Aye.
The vote is 10-0. That motion carries.
Thank you. That concludes our special meeting for the evening. Thank you for your attendance. We are adjourned.
Thank you.